name's Emily. I'm a student physical therapist.
Nice to meet you.
I'll be taking care of you today. So what brings you into the clinic today?
I've been having a lot of low back pain and I just feel really stiff.
Okay. On a scale from 0 to 10, how would you rate your pain? 0 being no pain at all and 10 being the worst pain you've ever felt in your life and you need to go to the hospital right now.
It's probably about a 3 or a 4. It's just more annoying than anything.
Okay. And when did the pain start?
A couple of weeks ago.
Okay. So we're just going to take some vital signs real quick just to get things started. Is that okay?
Yeah.
I'm just going to start off by taking your blood pressure. Stick your arm out for me.
Okay, cool. I'm just going to go ahead and check your back and everything again. Make sure everything's okay. And everything seems to be fine. Go ahead and face that way. And then I'm just going to move forward again. And go ahead and lean backwards.
Okay, so that's good. You're 110 over 70. Okay, so you take your pulse. Just make sure you got good circulation.
Just for the first time, we'd say we'll probably
It's bounding at 70 beats per minute, so that looks great. If I could go ahead and ask you to stand up, I just want to see if you have good range in your back since you said you do have some stiffness.
Okay.
So if you could go ahead and bend forward for me as far as you can.
Past there, it's pretty painful.
Okay. And can you go ahead and bend to your side for me? That feels okay? And to that side? Okay, great. So it looks like you're a little limited in bending forward. So if you could go ahead and sit down, I just want to check your sensation on your back. You can go ahead and lift your shirt for me. And don't look back here, but I want you to tell me if I'm touching the right, left, or the middle of your back.
Okay. Middle, right, left.
Okay, and I just want to check your skin just to make sure you don't have any inflammation or swelling. And that looks good. The skin temperature is good. You don't have any asymmetrical things going on back there. So. So I think the best treatment for you today would be using a hot pack. Have you ever used one before?
I have a heating pad in my house.
Okay, great. So this is pretty much the same thing. But I need to ask you some questions before we get started just to make sure it is the best treatment for you.
Okay.
Do you have any history of blood clots? Okay. And I checked your back. I didn't notice any bruising, but have you had any recent hemorrhaging?
No.
Okay. Are you pregnant?
No.
And have you used any thing on your back like Icy Hot or Bengay today? Okay, do you have any metal in the area that I need to know about?
I have a screw in my ankle, but...
Okay, well that's pretty far away from the area we're treating, so I think we'll be okay there. And do you have cancer? Are you being treated for it, or do you have a history of it?
No.
Okay, and I didn't see any open wounds. Do you have multiple sclerosis? Okay. So that all sounds okay. I think that we're going to be able to do the heat on you. I just want to let you know before we do get started that it can cause burning or tissue damage. But we're going to put lots of towel layers down. I'm going to check you often just to make sure none of those adverse effects happen. Okay. I'm going to go get that ready for you. I'm just going to get a large hot pack for your back. I'm going to make sure the temperature of the water is okay in the hydroculator. Okay, that's great. Make sure we double pat it so we don't get any burns. Okay. Okay, I'll just have you lay down on your stomach. And could for me. And you don't have a belt on or anything that has metal on your pants in this area, do you?
Nope.
So do you mind your shirt getting wet, because this is going to cause a little moisture, so you can either, I can put it on top of your shirt, or you can lift your shirt up, whatever's more
Oh
comfortable.
no, it's okay. I don't have anywhere to go.
Okay, great. So I'll go get that ready for you. I'll bring it back over, set you up.
Okay.
And what would you say?
Okay, great. So we're going to put about 6 towel layers down for you. I'm just going to move your hair out of the way. I don't want it to get wet.
Is there any?
So we're putting lots of towel layers down, just like I said, so we don't cause any of that burning or tissue damage that could happen. And are you ready for the hot pack? There you go. It should feel warm, but you should not feel any burning at all. So if that starts to happen, let me know. And we're gonna do it for 15 minutes total, but I'm gonna check you after 5 just to make sure everything's going okay. I'll grab the timer and a bell for you.
Go ahead and do an active, which basically will relieve some pressure on those
Okay,
joints.
I'm gonna set the timer for 5 minutes.
There's
Right here. And here's a bell. If you need anything, you start to feel any pain or discomfort, just ring the bell and I'll be right back.
Okay,
Does
thanks.
this sound like a, anyone go?
Okay, so it's been 5 minutes. Are you feeling okay?
Yeah, it feels great.
Okay, I'm just gonna check the skin under here just to make sure that everything's looking good.
Some of the muscles in your neck.
Checking your skin temperature, making sure it's not too hot, making sure there's no discoloration other than a little redness, which is normal. Because the heat is going to help you with that stiffness you have. It's just going to loosen up those muscles, and it's going to help you with your pain by blocking some of those pain receptors in your body. So hopefully after the treatment, everything will feel much better. And you said you're feeling okay, so we're going to head and do 10 more minutes for 15 minutes total. The bell's right here, so just let me know if you need anything.
All right, thanks.
Okay, how are you feeling?
Feels great.
Okay, great. So it's been 15 minutes, so I'm going to go ahead and take everything off of you. And you can go ahead and sit up. Step out of your way. Okay, so is your pain any better?
It is. I think it's only about a 1 or 2 now.
Okay, great. So that's what we're hoping to get with this hot pack. I'm going to test your sensation again just to make sure everything's okay back there. So I want you to tell me if I'm touching your right, left, or middle of your back.
Okay. Middle, left, left, right.
Okay, everything looks good there. And if you could go ahead and stand up for me again, I want to see if you got a little more range because that hot pack was supposed to help soften up all the tissue. So go ahead and bend forward for me. Okay, great. It looks like you went a lot further that time, so it's doing what it needed to. Go ahead and bend this way for me. Okay, and that direction. And no pain with that? Okay, awesome. So you can go ahead and sit back down. I'm going to give you a list of exercises to do at home just to help you decrease some of that muscle stiffness you said you're having. And you said you had a hot pack, correct?
Yes.
Okay, so I'm going to have you go ahead and use that at home just whenever you feel the need to, but just don't use it for any longer than 20 minutes. I wrote the instructions down here with your exercises to go by. So here's all of that. And I would like to see you back here in about 2 days to continue treatment.
Okay, sounds great.
Okay, have a good day.
You too.